Total ankle replacement is indicated for the treatment of severe ankle arthritis in a appropriately selected group of patients. For example, when the activities of daily living are difficult or even light exercise is compromised because of severe ankle pain, a total ankle replacement may be an excellent treatment option. Patients are typically, for example, older with reasonable body weight and modest activity levels, and may have desires to return back to simply walking, cycling, or swimming, or maybe even light exercise in the gym. Arthritis is a progressive condition of the ankle joint where there is progressive loss of the smooth gliding cartilage, and as a result of that you can develop stiffness and pain with weight bearing and loss of range of motion, and this can impair mobility. So in a total ankle replacement, a portion of the tibia bone and the talus bone at the ankle joint is resected, and we replace that portion with specifically sized biocompatible materials of various metal alloys like titanium or cobalt. In between those metal components, we put in a plastic spacer made of polyethylene. This is the substance that absorbs shock and allows the ankle joint to move. The materials are essentially identical to those in knee and hip replacements. In an ankle fusion, the tibia and talus are essentially fused or welded together. This reduces joint pain because the joint no longer exists, and therefore you lose joint motion. Total ankle replacement has its appeal because while we are eliminating pain in the ankle joint, we're able to preserve joint motion. There are many things to consider between an ankle fusion and a total ankle replacement, and these factors include things like the patient's age, activity level, their body weight, occupation, and presence of foot deformity and other alignment problems that would lead us to choose one procedure over another. So even though a patient may not be a candidate for a total ankle replacement, at Virginia Mason we do have other options available. As we talked about ankle fusion before, we also have minimally invasive techniques like ankle arthroscopy and cartilage restoration techniques available.